I'll begin this video with this slide, which I should have included at the end of the last video. Remember in the last video we ended with the male duct system. Epididymis, ductus deferens, ejaculatory duct, all of which we covered, but we did not cover the urethra. So again, I should have had the urethra in at the end of the last video, but that's okay. We'll start this video with the urethra. And here is the urethra. Let's use a good pointer. There we go. The urethra conveys urine and semen, of course, at different times, but that is different from the female reproductive system because the urethra there only conveys urine. But in the male reproductive system, both semen can use this urethra route and urine. It has three regions. The prostatic urethra is this part of the urethra that is surrounded by the prostate gland, hence its name. And then we have this small section of urethra called the intermediate, there's the intermediate part of the urethra, also the membranous urethra, and that's where that urogenital diaphragm is. So this is your pelvic floor, and there's the muscles, the sphincter muscle, which can close the urethra and open it to let urine through or not. But that small section of urethra right at that spot is the intermediate part, or the membranous urethra, where the distal end or final part of the urethra is the spongy urethra that runs through the penis, and it ends at this external urethral orifice, which is the opening to the outside right there. Now we get to the penis, which is the male copulatory organ. It consists of the root, which is wider, and then it ends at the glans penis at the distal end. There's the label, and the body would be in the middle between the root and the glans. The prepuce, or foreskin, is a cut of loose skin covering the glans. So there it is. We could see prepuce or foreskin labeled. There's the skin covering the glans, and circumcision is when that foreskin is removed, which is about 60% of males in the U.S. Other countries vary in percentage of circumcisions. You can see some countries are only 15%. Often in parts of the world, it depends on religion, whether it's acceptable or not. There really is no anatomical reason for it or physiological reason for it. It doesn't make a difference, except some studies show that in circumcised individuals, they'll have a reduced risk of HIV or other infections when the foreskin is not present. Internally, here's a cross section. We have this spongy area, spongy because it can fill with blood in order to stiffen. It has three cylindrical bodies of erectile tissue. And recall the spongy urethra is the urethra within the penis here, which we can see the spongy urethra in this cross section as well. So the three cylindrical bodies of erectile tissue are all spongy networks of connective tissue. They have smooth muscle. They have vascular spaces, and you can see all the spaces in the sponginess here, which fill with blood during erection. So the three cylindrical bodies are, well, we have a corpus spongiosum, and that area surrounds the spongy urethra, and it expands to form the glans and the bulb of the penis, which we see right in through here. So that was the corpus spongiosum. And then there's two corpora cavernosa, which are paired electral bodies. We can see one on this side, one on that side, that also fill with blood. In the cross section, we can see the spongy urethra, the corpus spongiosum, which surrounds the spongy urethra on either side of it. And up here, we can see the corpus cavernosum. Even though there's two of them, since this is a section, you're only seeing one of these two, but there are two, a left and a right. Next structure of anatomy is the male perineum, and that's a diamond-shaped region. This diamond shape consists of the pubic symphysis, the coccyx bone right there, and the ischial tuberosity. So that kind of diamond-shaped area there is the male peritoneum, which suspends the scrotum, contains the root of the penis and the anus as well. Not really much or anything else to say about the male peritoneum. I just said peritoneum, I meant perineum, excuse me. And the final part of the anatomy of the male reproductive system are the male accessory glands. And of course there's three of them that we need to go through. The seminal glands, or also called seminal vesicles, we see right here. We have the prostate gland right there, and the bulbourethral gland. Those three glands are left to cover for the anatomy section of this chapter. So let's go through the seminal glands, or seminal vesicles, first. They contain smooth muscle that contracts during ejaculation. So in the walls of this gland, we have smooth muscle. It produces a yellow, viscous, alkaline seminal fluid. So fluid gets secreted out of this gland. That comprises 70% volume of semen. So semen is mostly fluid from the seminal vesicle or seminal gland that gets released through the smooth muscle contraction. The duct of the seminal gland, we mentioned this earlier, joins the ductus deferens to form the ejaculatory duct. So there's the duct coming out of the seminal gland. There's your ductus deferens. So when the two come together, right there, that is the ejaculatory duct. And we should also note alkaline seminal fluid, and we'll see a pattern with alkalinity or basic versus acidic as we're going through all the glands, and as we go through them we'll see why it's alkaline versus acidic. Next, the prostate encircles the urethra, which you can see right here. It surrounds the urethra. There's the urinary bladder, so it's inferior to the urinary bladder. It consists of smooth muscle as well that contracts during its ejaculation, just like the seminal gland. It secretes a milky, this one slightly acidic fluid. It contains PSA, which is prostate-specific antigen, which we'll mention again a little later, which is an antigen that we test for an enlarged prostate or sometimes prostate cancer. Not the most reliable measurement. The prostate also plays a role in sperm activation. So as sperm gets released through the epididymis, ductus deferens, and then joins with the fluid of the seminal vesicles, and then joins with fluid from the prostate gland, that secretion of prostate fluid helps to activate the sperm. It enters the prostatic urethra during ejaculation, and we're talking about the fluid coming from the prostate gland, and it makes up 1/3 of the semen volume. That, of course, is a rough estimate because the other gland, which we already covered, the seminal vesicle, was 70%. Add 1/3, which is 33%. Now you're at 103, so of course we can't get more than 100%, but approximately 1/3 of the semen volume is the secretion from the prostate gland. Now, an enlarged prostate, or BPH, which is benign, meaning not cancerous, prostatic hyperplasia, which is a term for enlargement, affects half of men that are 50 years old and 80% of men that are 70 years old. It's a benign growth, prostate, and that will constrict the urethra, because remember, the prostate gland surrounds the urethra. So as it enlarges, it starts pressing on that tube, on the urethra, making urination difficult, leading to incomplete emptying of the bladder, which we called urinary incontinence in the past in the urinary system. That can lead to urinary tract infections or kidney damage, because as urine starts to back up, the more backup there is into the kidneys, the more possibility there is for the kidney structures to become damaged. So methods to treat BPH are drugs to relax the smooth muscle, to therefore take the pressure from the prostate off of the urethra. Also drugs to inhibit growth of the prostate gland. And sometimes surgical transurethral resection is used, where they would go in and surgically widen the prostatic part of the urethra. And remember, that's the part of the urethra surrounded by the prostate gland. Prostate cancer is the third most common cause of death, as far as cancer deaths, in male. 1 in 6 in the U.S. men will have prostate cancer. However, it's a very slowly progressing cancer, and often happens later in life, that it grows so slowly, people tend to die with it rather than from it, because of the slow-growing nature of it, which is, I guess, would be a plus as far as cancer goes, that it's so slow-growing. Typically, there are more aggressive types, of course. A digital exam screening is one way to test for it. That won't tell you if someone has prostate cancer, but it could determine an enlarged prostate, which someone would go on then to further testing for prostate cancer. The PSA levels, the prostate-specific antigen levels, can be checked. However, they have a high degree of false positives, where someone might have high PSA levels, but it doesn't necessarily mean they have prostate cancer. If prostate cancer is advanced, it's treated with surgery and sometimes radiation. Metastatic prostate cancer, this is the cancer from the prostate that starts to spread to surrounding tissues, is treated with drugs that block testosterone synthesis, because as the prostate enlarges and it becomes cancer and it starts to spread, the hormone testosterone actually is fueling this process. It's making it occur and making it occur faster. So blocking testosterone could help block the spread of the cancer cells to the surrounding tissues. And one more gland to go through, this tiny one right here, the bulbourethral gland. Pea-sized, it's inferior to the prostate. Well, there's the prostate, and just below it, inferior, is the bulbourethral gland. It produces a thick, clear mucus during sexual arousal to lubricate the gland's penis and neutralize traces of acidic urine in urethra. So this secretes its fluid before ejaculation to get ready for it. Urine is acidic, and when urine travels through the urethra, so the secretion from the bulbourethral gland will help to neutralize, there it is, traces of acidic urine because of its alkaline properties. And the sperm cells rather an alkaline environment than an acidic environment. And also, its secretion will help lubricate the gland's penis for penetration. And we'll end this video with 2 slides here with about semen, milky white mixture of sperm, and accessory gland secretion. So we have our 3 accessory glands, which all secrete to contribute to semen. However, the bulbourethral gland is really pre-semen secretion. And 2 to 5 milliliters of semen are ejaculated. Only 10% of that is sperm, but in 2 to 5 milliliters, there's 20 to 150 million sperm cells in that in that secretion. Semen is a transport medium for sperm. It contains nutrients to help the sperm remain healthy. It protects and activates the sperm and facilitates sperm movement. So all of these secretions that we're talking about in the semen are there to aid the sperm in its job, which of course is reproduction, would be its ultimate purpose. Semen is alkaline because most fluid of the semen, majority of it, is alkaline as opposed to acidic. So the alkaline fluid neutralizes the acidity of the male urethra, because remember, the male urethra conducts urine as well, which is acidic. We need to neutralize that. And the semen does that, neutralizes the male urethra and also the female vagina, which enhances motility. Sperm is able to move much more efficiently in an alkaline environment versus an acidic one. So finally, a whole list of products here that semen contains. Prostaglandins decrease the viscosity of mucus in the cervix and stimulate reverse peristalsis in the uterus. So these are smooth muscles and contractions in the uterus, reverse meaning contracting upwards to aid in sperm being propelled into the correct direction for reproduction. Semen contains the hormone relaxin and other enzymes that enhance motility of the sperm. Contains ATP for energy, fructose for ATP synthesis of the sperm cells, because of course they need to continually move with their flagella, and they need ATP for that to happen. And of course they'll need nutrients in order to produce the ATP, citric acid for nutrients. Semen contains molecules that can suppress the female immune response, and this is important because we don't want the immune system in the female to destroy the sperm cells, and that would defeat their purpose. They contain antibiotic chemicals that destroy some bacteria, and clotting factors which coagulate the semen. So when the semen is inside the female, it is better suited to remain inside if it coagulates. That prevents draining out. But then enzymes liquefy it so it can finish its journey upwards into the uterus.